Are you suffering from pain in your knee and you're wondering whether or not it's a meniscus tear? If you are, then this video is perfect for you. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be giving you 3 simple tests that you can do at home that can help to identify a possible meniscus tear. Now, before we dive into the content of the video, if you haven't already, please like this video and subscribe to the channel using the link in the bottom right, because then you'll be the first to hear about our new knee videos when they come out. We've got loads of stuff in store to help you with knee problems like meniscus tears. And if you're enjoying the content on this channel, I really appreciate it when people share the channel with a friend or family member who might be in need, because then you'll help that person and you'll help us grow as a result. So thank you very much if you choose to do that. Now that that's been said, let's talk about meniscus tears, what they are and how to identify them. So what I'm going to do today is I'm going to tell you what a meniscus tear is. I'm going to give you some of the common signs and symptoms of a meniscus tear and how an injury to the meniscus might happen. Then I'm going to show you 3 simple tests you can do at home to pick up a meniscus tear. So a meniscus is a structure that lives within the knee. So this is the knee joint here. We've got the thigh bone, which is the femur. We've got the tibia here, which is your shin bone. And then we've got the kneecap at the front. So a normal knee moves like this. So we bend the tibia down like this and the kneecap slides up and down in that groove. Now, if we bend the knee and we move the kneecap out of the way, you can see between the 2 bones here, we've got this thick layer of cartilage which acts like a shock absorber, and we call that the meniscus. So the meniscus is a layer of fibrocartilage which basically stops force traveling up through the shin bone into the femur. And the thing about the meniscus is it's very, very good at its job. It stops that force from coming up the leg, but it's very tightly attached to the shin bone. Now, the reason this is significant is because it's so tightly attached, it can't tolerate twisting. So if we get twisting on the knee, that often leads to an injury of the meniscus. Because it's so tightly attached, it's got nowhere to go, so it ends up tearing. So we call a meniscus injury a meniscus tear, because usually what it looks like is either a gathering of tiny little fragments of tears that have all joined together, or it's a frank tear, which is a very clear rip across the meniscus. And there are different types of meniscus tears, but those don't matter as much for the content of this video as learning what the signs and symptoms are. So in terms of a meniscus tear, the most common people to be affected are active people over the age of 40. So that's the most common group. It can happen equally in men or in women. And usually the injury starts quite suddenly. So it starts with a twist of the leg, or you try to move something with your foot, or you slipped when you were out walking and suddenly there's pain in your knee. Now, meniscus tears can also start slowly. So we sometimes see people who have very mild knee pain to begin with that becomes worse and worse and worse. That can also happen. But a true tear in the meniscus is usually quite quick. If it starts slowly, we tend to think of that as what we call a degenerative meniscus tear. So that's usually associated with arthritis as well. Now, meniscus tears usually appear as pain that occurs over the joint line. Okay, so it's usually very specific pain. It's right over that gap between the 2 bones. So it's on the side of the knee, either the inside or the outside of the knee. And quite often, meniscus injuries cause pain when you're weight bearing. They cause pain when you twist. They cause sometimes weakness in the leg, so it can feel like the knee's going to give way. And sometimes they can also cause a symptom called locking, which is where the knee, it gets stuck in a certain position and you have to use your hands to free it up and manipulate it so it can get moving again. And the reason locking can happen is because the loose tear in the meniscus can get trapped between the 2 bones, and then the body basically doesn't let you move your knee until that meniscus tear has become untrapped. So it's a very unpleasant symptom. Thankfully, it's quite rare, but it does happen. So those are the common sort of signs and symptoms of a meniscus tear. Unfortunately, meniscus injuries take a long time to get better. So another sign is that someone's been suffering for several months and it's still no better. But there are a couple of self-tests you can do at home if you're in any doubt as to whether or not this is your injury, which are pretty good at ruling out other problems and ruling in a meniscus injury. So I'm going to show you what these 3 tests are now so you can have a go at them at home. So there are 3 simple tests you can do at home to help you identify a meniscus injury. So I'm going to show you what they are now. And these are tests that I would do in clinic to help me identify someone else's meniscus injury, but there's no reason why you can't do these on yourself at home. So the first test is actually the most specific, reliable, and replicable test for a meniscus tear. It's the one that gives us the most reliable result every single time, and it's very, very simple. All this test is searching for tenderness along the joint line. So the joint line of the knee is the gap between the 2 main bones, the femur and the tibia. So it's the gap between your thigh bone and your shin bone. So it's this gap here. I'm going to show you by rolling up my trousers here, if I can get them above my leg. So here we are, I've just exposed my knee, trying not to cut off the blood circulation. And basically what I'm going to do is I'm going to feel for my kneecap to begin with. So my kneecap is here. And then I'm going to come around both sides and you'll feel a dip at the sides of your kneecap. And then as you come further round, you'll feel the 2 bones of your knee. So you'll feel the thigh bone a bit higher up and you'll feel the shin bone a little bit lower down. And all you're going to do is you're just going to feel around the joint line with your knee bent, following those 2 bones and the places they join. Now, people with a meniscus injury tend to find that it's quite sore to touch these bits here. And this is a very useful test because it helps to differentiate a meniscus tear from arthritis. For most people, arthritis doesn't cause tenderness along the joint line. It can cause similar pain when you walk to a meniscus tear, but when you press around, arthritis doesn't tend to cause pain, but a meniscus tear does. So it can help us determine whether it's a degenerative meniscus tear or arthritis, most likely causing the person's pain. Now you might find that you need to feel around the back of the joint line as well. So you want to search right underneath the knee as well, following that joint line round. Really what we're looking for is the crease between the knee. As we bend it, you should have some creases at the back of your knee. So you're feeling around that area. What we're looking for is what we call pinpoint tenderness. So it should feel quite sore to press, almost as if you want to pull away. That's a positive sign for a meniscus tear. So I'm going to show you a bit closer up what that looks like, just so you get a better idea of which areas you'll be feeling of the joint line now. So if you can see my knee here, the areas of the joint line that we're looking at would be starting the patella, and then we work our way around on the inside, and we want to feel the gap between the 2 bones. We're following it all the way around with our fingers. So like this, pressing in quite deeply as if we want to just touch the place between the 2 bones coming around here. And we're looking at a similar place on the other side of the knee if it's a lateral meniscus tear. Now, the second test that can help to identify a meniscus tear in the knee is something called the Thessaly's test. And this is a test I'll ask people to do in the clinic as I watch. There's no need to have a therapist there. You can do it on your own at home. So we need to do this test standing up. So I'm going to show you by the wall over here. So what you need to do is you need to find something to hold on to, preferably something that you can use to catch yourself if you lose your balance. And you're going to stand just on the affected leg. So if my right leg is the problem, that's what I'm going to stand on. And I'm just going to slightly bend my right knee. Now, if this test is painful, you're going to stop it straight away. But if this feels okay, we can take it to the next step. And the next step is to turn our body both to the right and then to the left. And you can see if you've got a very acute meniscus tear, this is not going to be a sensible test for you because we know the outcome is going to be painful. But if you've got, an on and off, it's kind of a mild pain and you want to test whether it's a meniscus injury, this can be a very useful test. So you're standing on the one leg with the knee bent and you're turning the leg. Now, a positive result would be quite a sharp pain in the knee or feeling like the knee is going to give way, that's often a sign that there is an underlying meniscus injury. This test is less sensitive because it can also cause pain in other types of injuries, but it can be useful in identifying a meniscus tear. Please make sure you're very, very careful when you do this test, and only do it if you know you've got enough strength to support yourself and you know you're not going to get a severe case of giving way that causes you to fall. And then the third and final test for a meniscus tear is one that only some people will be able to do. And this is a test that I would usually use in my younger population, or people who have got quite a mild meniscus injury, or they've got a mild knee pain. We can't quite work out what it is. The other tests haven't really worked. And what we need to do is really stress that meniscus to see how it's functioning. So for most people watching this video, it's probably not going to be suitable for you. But if you're a younger person or you've only got quite a mild meniscus pain, then this is probably going to be okay. But make sure you check with your healthcare provider before you try it. Now the test is very simple. We're basically just going to ask the person to sit on their foot. Okay, and I'll show you how that looks. So what you're going to do is find a chair, you put your foot down behind you, and you sit down like this. Okay, so we need obviously a really full range of knee bend. Not everyone is going to be able to do this, and this is not going to be a great idea for everyone. But if you're not sure whether you've got a meniscus injury, this is a fantastic way to test it, because it's really stressing the joint. It's pushing those two bones together. If there is a meniscus tear in there, it is going to pinch it. The problem with this test, of course, is that it's not specific for only meniscus tears, so it will bring up other problems in the knee. But if you're suffering with a niggly knee, you can't quite work out what's going on, sometimes it's worth doing that test just to see if the meniscus is healthy. The best thing to do after you've done it on one side is compare it to the other. If it feels very different, there's a chance you've got a tear in the meniscus. However, this test is not as proven as the joint line tenderness or the Thessley's test, so it's only to be used as a backup, and again, it's not going to be useful for everyone. So those are the 3 simple home tests you can do to identify a meniscus injury. I hope this video has been useful for you, and if you have found that these tests are positive on you at home, the best thing you can do is go and seek some advice from a specialist, someone like myself who's experienced in treating problems like meniscus tears. And basically, you can usually get help. Therapy helps to speed up the healing process, and even though it won't be quick, it should still happen a bit quicker than if you just left it alone. So that's all I've got for you today. Thank you very much for watching. If you've enjoyed this video, then please leave a comment below. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. It's got loads more information about knees as we get older and how to protect them later in life. Anyway, that's all from me today. Thank you for watching, and I look forward to speaking to you on the next video.